countries and other communities. From the beginning of this crisis, I've been in touch with the county executive in Seattle, Washington, and learning from what they're seeing, learning from San Francisco, learning from other areas. And what we see is, in a lot of ways, them playing catch up, having to mandate draconian measures to just catch up with spread of the disease once it's gotten out of hand. Once you get to that point, the impact to the economy is much harder. So we are trying to be smart, to get ahead of the curve, to protect ultimately the health of our entire community, and to ensure that we don't have a collapse of our healthcare capacity and therefore really a crisis in our society. One thing you never get back during an event is time, and we are using the time we have now to prepare and to get ahead of this incident. So we're going to be announcing new guidance. The guidance has the goal of flattening the curve in which we will see new cases. The goal is to not have a spike in cases, and particularly the people that will be needing our healthcare system. We didn't make these decisions in a vacuum. We've been, as I mentioned, reviewing the lessons from other countries, other communities. We've been discussing amongst ourselves, speaking with our public health experts, and thinking about how we can be as smart as possible in getting ahead of this. The crux of these recommendations we are announcing is a couple of things. First, we cannot do this alone. We need to do this hand in hand with the community. And as long as we're able to do that, we will succeed. So these are all recommendations. We ask people to use their best judgment. These are all recommendations, and we hope that the community will partner with us in making sure that this takes place. The recommendations will go through to the end of the month. In the meantime, as you all know, as we've discussed before, we have limitations in testing, and that's part of the problem. Ideally, we would have testing centers all throughout our region, so anybody who might have the disease can go and get tested and then be self-quarantined. But right now, we don't have that capability. Even the cases we're running down right now, we're running into obstacles, tracing them, running into obstacles with the testing. And so we have got to develop that testing capacity locally, over and above what the federal government has been able to provide for us. And we are working around the clock with our partners at the medical center, with the city of Houston, all working together to try and develop that. So ideally, these recommendations will buy us some time to be able to get to that phase. Now, here's the recommendations. First, we are asking that the community think very hard about any gathering of people. We encourage gatherings to the extent that they can be to be postponed or be done online. We are strongly urging that organizers of gatherings over 250 people cancel those gatherings. This is something that we need the community's help with. And again, we ask folks to use their best judgment. This is a recommendation, but that is what we're asking. Seniors and senior centers, folks at higher risk should not be participating in gatherings, and that includes seniors. And so we're working with the senior centers to limit visitation and take precautions so we don't end up in a situation like what has happened in Seattle, where they had at least 19 people die in a senior center. We are issuing specific guidance for the senior centers, and we will be convening them with our partners to discuss and see what we can do to answer questions and support. Generally, folks at higher risk, whether it be seniors or folks with pre-existing conditions, we're asking them to stay away from gatherings. Finally, one more note, for the employers, maximizing telecommuting, helping us try and get our workforce to the extent that we can to not be in close contact with one another. We are not, at this point, recommending that schools close. If a case is diagnosed at a school, public health of each of our respective jurisdictions will work with the school in question. But we know that children, of course, they are cause for concern, even though they're not the most affected, they are carriers. That said, if the kids are not at school, they would be in daycare, they would still be in groups. We have evidence from H1N1 that when schools were continued to happen or were canceled, there wasn't much of a difference. More importantly, if we send the kids home, our emergency operators and workers, our healthcare workers, will not be able to work, and we need them in the front lines. And so we are sending guidance to the schools for them to stagger classes, to take special measures for the kids who are sick, and a series of other recommendations we'll be releasing for the schools. We're convening all our school districts here tomorrow to have an additional discussion about this and coordinate, offer guidance, and offer whatever support we can offer. Harris County is taking the lead on this. Just as Mayor announced his steps yesterday, we're taking our own steps. We are canceling all permitted events in Harris County that are county permitted events. We are canceling events with seniors. Toll roads are no longer accepting cash. We are suspending community outreach meetings, suspending non-essential personnel travel, asking that our essential personnel not take vacation so they can save that vacation time for when we most need them, reviewing continuity plans, limiting in-person meetings, and our civil judges are suspending jury calls for a month. All jury duties also suspended until March 20th. For people who are sick, the guidance is the same, to not go out in public. Please call your doctor. Do not show up at the doctor's office. If you have symptoms consistent with coronavirus, stay home. Reach out to us. There is a line that we've shared before for the folks who are uninsured or who do not have a healthcare provider. Our authorities are not asking whether folks are documented or undocumented. For the general public, wash hands, cover your cough. Again, encourage folks to work from home if you're an employer and you see folks who are sick. And just help us with these recommendations. It is really our effort to get ahead of the curve, to use the science and the data, and to work together as we do this. En español, brevemente. Hemos venido estudiando la situación y sé que continúa habiendo mucha ansiedad, mucha preocupación en la comunidad acerca del virus. La realidad es que hemos sobrevivido juntos huracanes, inundaciones, explosiones, todo tipo de situaciones, y lo hemos hecho todos juntos. Entonces, hoy día vamos a pedir a la comunidad que nos ayude a tomar unos pasos, unas recomendaciones que todos juntos hemos decidido. La última información. Sabemos que hay comunicación en la transmisión en la comunidad. Sabemos que en este momento hay 17 casos en nuestra región que hemos identificado, pero obviamente hay más personas que estamos llevando a cabo pruebas, que están bajo cuarentena y más gente que estamos observando. Nacionalmente y localmente la economía se ve afectada. Es muy difícil para aquellos que dependen en eventos, que dependen del tipo de situaciones que se cancelaron anoche, y para todos, a todos nos afecta una economía que se vea impactada. Eso dicho, si llegara un punto en el cual 30% del condado resulta teniendo el virus, y eso es una proyección mínima, es asumiendo pues una situación buena, 20% de ese 30% tendría que ir al hospital, requeriría tratamiento urgente, cuidado urgente. Eso sería demasiada gente para nuestro sistema de hospitales. Completamente inundaría nuestro sistema de salud regionalmente. Nuestra economía es tan fuerte como la fuerza la resistencia de nuestro sistema de salud. Y si nuestro sistema de salud no resiste este virus, no vamos a poder seguir adelante bien como comunidad. Entonces, lo que queremos hacer ahorita es prevenir que haya un crecimiento rápido en los casos, intentar que los casos crezcan de una manera pausada para que no se vaya a ver el sistema de salud completamente inundado. El sistema todavía tiene que manejar ataques al corazón, mujeres embarazadas, personas bajo diálisis y cualquier otro tipo de emergencia. La decisión que hemos tomado es basada en evidencia de otros países y otras localidades, conversaciones con nuestros directores de salud pública y entre nosotros. Estamos aquí con el alcalde de Houston, el juez del condado de Fort Bend, he estado en comunicaciones con el juez del condado de Montgomery, quien también está de acuerdo con nuestras recomendaciones. Estas recomendaciones son eso, son sugerencias. En este momento no estamos requiriendo nada, pero le estamos pidiendo el favor a la comunidad de que nos ayuden. Vamos a poder sobrevivir esto y hacerlo bien, mejor que otras comunidades, si es que trabajamos juntos. Entonces, estas son las recomendaciones. Primero, le pedimos a todos y las recomendaciones son hasta el fin de marzo, al fin de marzo. Esperemos que en estas semanas que nos quedan de este mes podamos desarrollar la capacidad local de llevar a cabo pruebas. Sabemos que hay límite en el número de pruebas que podemos llevar a cabo que nos ha ofrecido el gobierno federal y ese es un obstáculo enorme para nosotros. La meta es tener centros de pruebas regionales donde cualquier persona que se sienta enferma puede ir y ser examinada. Y estamos trabajando día y noche con el centro médico para desarrollar esas pruebas. Entonces, esto nos va a ayudar a ganar un poco de tiempo para poder desarrollar las pruebas. Las recomendaciones son que la comunidad piense muy cuidadosamente acerca de cualquier reunión de personas, cualquier reunión que vaya a tener a la comunidad cerca, pues, los unos de los otros, intenten cancelarla, posponerla o hacerla vía teléfono, vía computador. Muy fuertemente pedimos que las personas cancelen, los organizadores cancelen cualquier reunión de más de 250 individuos. Especialmente cualquier reunión que tenga personas mayores de 60 años o de alto riesgo, se les pide que por favor cancelen eso para ayudarnos a contener este virus. En las escuelas, no estamos pidiendo en este momento que las escuelas se cancelen. Sabemos por un lado que los niños no se ven tan impactados, por el otro lado también sabemos que los niños podrían transmitir el virus a sus abuelos, por ejemplo, personas de alto riesgo, pero si canceláramos escuelas, los niños estarían en guarderías, estarían en grupos y además necesitamos que los padres, o sea, los trabajadores de salud, los trabajadores de emergencia puedan ir a trabajar. Entonces vamos a mantener por ahora, recomendamos, las escuelas obviamente toman sus decisiones, pero no estamos recomendando que cierren. Sí tenemos guías para todas las escuelas de qué cosas pueden hacer, por ejemplo, no tener todas las clases al tiempo, oportunidades para niños enfermos que puedan estudiar desde casa y este tipo de guía. Vamos a reunirnos con todas las escuelas, los distritos escolares mañana para seguir discutiendo esto y ver cómo los podemos apoyar. Todos los centros de personas mayores, estamos enviando también guía especial para esos centros basados en la realización que no queremos llegar a un punto como Seattle, donde 19 personas mayores murieron en uno de estos centros de cuidado. Entonces, pedimos también que estos centros tomen precauciones adicionales, como limitar el número de visitantes y evaluar a cualquier visitante, y esa es la información que estamos compartiendo. Para los dueños de empresas, de negocios, que nos ayuden a intentar que sus empleados trabajen de casa hasta donde sea posible. Es algo que haremos todos juntos. El condado Harris está liderando por nuestro ejemplo. Hemos cancelado todos los eventos a los cuales nosotros damos permiso, hemos cancelado eventos con personas mayores, no estamos ya recibiendo billetes en los peajes, estamos pidiéndole a los departamentos que trabajen de casa, hemos suspendido viajes no esenciales, hemos pedido a los trabajadores que no tomen vacaciones, los trabajadores esenciales para que guarden todo ese tiempo para cuando se les necesite, limitando las reuniones en persona. Los jueces civiles han cancelado los jurados para casos civiles por un mes y todos los jurados han sido suspendidos hasta el 20 de marzo. También estamos aquí activados a un nivel 2, hemos subido de nivel 3 a nivel 2, lo cual significa que estamos aún más alertas a esta situación. Entonces, para concluir, esto es medidas preventivas. Lo más importante en este momento es el tiempo. Entonces, tenemos que ganar ese tiempo, invertir ahorita en precauciones para que la economía y el sistema de salud no se vean más afectados en un futuro. I wanted to clarify in English that I did not mention earlier, our Harris County Office of Emergency Management has also now activated to level 2. So we were at level 3 yesterday, and we have upped that because we want to make sure that, that we are even more focused and all working together on preventing this virus. And so again, this is about making sure that we are being proactive, that we have time on our side, and that we are preventing harder hits to our economy and certainly catastrophic hits to our healthcare system. So I'll invite Dr. Shaw to give brief remarks, then Mayor Turner, followed by Dr. Peirce and Judge George.
Thank you, Judge Hidalgo. My name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health, also the local health authority for Harris County. I also want to thank our colleagues and partners at the City of Houston, Fort Bend County, Montgomery County, and Galveston County, as well as our regional partners with the State Health Department. I particularly want to thank Dr. Peirce, who's here as a health authority for the City of Houston, as well as Dr. Minter, who is the health authority for Fort Bend County. The two of them have been extremely strong partners in this fight against coronavirus since day one, and I really do want to just appreciate the work that they have, partnership that they've provided. I also want to thank Jennifer Kiger, who's to my right here. Jennifer is one of the seamless behind-the-scenes people who is our Chief of Preparedness at Harris County Public Health, who every single day and night has been working along with emergency management, the judge's office, and other partners to see to that our community is protected. Yesterday was a very difficult day for us in our community. The cancellation of the rodeo, disaster declaration, a lot of information that happened during the day, and then additional information in terms of presumptive positive cases from yesterday evening into today. So we know there's a lot of information that's coming out, and we know there is anxiety in our community. We are doing the best that we can in a methodical manner to provide information as quickly as we can, but to ensure that information is reliable and accurate, but at the same time to make recommendations on how people can protect themselves. And that is what these guidelines represent. They represent an opportunity for our community to come together and work with all of us, because we cannot do it alone, for us to work with our community and our community to work with us in order to fight against novel coronavirus. We hit a significant milestone just this last 24, 36 hours where we now have the initial, at least the initial recognition of community spread. And now that time is for all of us to do all the things that we can do individually, but as the judge has highlighted, for businesses, for schools, for nursing homes, and for all sorts of other significant activities that are happening in our community, we want to make sure that people use common sense. The number one thing that is going to get us out of this scenario and to bend the curve that the judge mentioned, and also allow us to get ahead of what's been happening in other communities, is for all of us to use common sense. And we've talked about those messages on how to, if you're sick, not to infect others or expose others. And if you are in a large gathering, we know that that is going to be a potential for spreading disease very quickly. So these guidelines are recommendations. We are hopeful that our community is going to not just follow them, but they're going to share them, they're going to adhere to them, they're going to do everything they can to protect the people that they serve. And that is absolutely critical to the fight against novel coronavirus. And with that, I wanted to just confirm, the judge had mentioned there are 17 cases in our region. That includes 6 cases in Harris County, 3 in the City of Houston, 6 in Fort Bend County, and 2 in Montgomery County. And that's 17 cases, and certainly we confirm confirmed our 6th presumptive positive case just this morning, and I can provide additional details for that in a bit. But I want to just emphasize that our job in public health is the health and well-being of the entirety of our community. And before I close, I do want to make mention that there were a number of helplines that we have for Harris County residents, as well as City of Houston, Fort Bend County, and I want to make sure that if folks have questions about what we are saying, if there's information they're seeking, and including if they feel that they need to talk through clinical information, the health departments, City of Houston, Harris County, Fort Bend County, all have health lines that are available, as well as Harris Health System has Ask a Nurse available for those clinical questions. And so we want to come together, provide as much information as we can, and just a reminder to go to readyharris.org for additional information, and I'm going to turn it back over to the judge. Thank you.
Mayor Turner.
Judge, let me thank you for your leadership, and Judge K.P. George out of Fort Bend, thank you for your leadership, and for everyone for being here today. Also, in addition to Dr. Purse, Chief Bunick from the Office of Emergency Management for the City of Houston is also present, so I want to acknowledge his presence. Let me just say very briefly, what we do know is that we live in a very mobile society, and that people move around from Houston, Harris County, Fort Bend, Montgomery County, a very mobile society. And Judge, under your leadership, we also recognize that we need a set of recommendations that cover our entire region. And so that we're pretty much all operating off of this, from the same hymnal book, if you allow me to say that. And that's what we are attempting to do today with these recommendations. We also recognize that one of the primary objectives is to contain and mitigate the coronavirus. We recognize that there will be more cases, but the goal is to contain and mitigate so that our whole healthcare delivery system is not overwhelmed. Where things are right now, they can handle the capacity. But it is important for us to get out and to do everything, take the initiatives that we think are reasonable and practical and that will be impactful to contain and mitigate. And that's what we all are attempting to do. I indicated on yesterday, for example, the things that the City of Houston is putting in place through the end of March. Any events, for example, that are city-produced, sponsored, permitted, those events are being rescheduled or canceled through March. And Judge Hidalgo has laid out other recommendations in terms of gatherings or events of more than 250 that will also go to the time period through the end of March. And we think those things are important in terms of containing and mitigating what we are facing. And so if we do those things collaboratively, if we work together, then I think we can, along with our healthcare delivery system, then it will give them the ample time to put in place the testing mechanisms so that more people can be screened and we can have a better sense of what's taking place in our respective communities. And all of the things that we are doing in concert with the medical community, because everyone is recognizing that we're needing to test more, and that's the overall goal. Now let me just say, as we put in place the either canceling or rescheduling events through the end of March, the city is still moving forward. I saw something on social media that said the city was going to be shut down. Totally not true. In fact, I had several messengers saying that. That's not true. So let me say to people, be very careful of what you're getting on social media, because it only adds to the confusion. With the exception of the things that we have put forth, the city is moving forward. We're continuing to conduct our business, but it's important that we all do things in a very responsible fashion. I do want to add something else with respect, because we're telling people to wash their hands, okay? And it's very difficult to do that, for example, especially for those individuals who may have gotten behind on their water bills and run the risk of disconnects. Well, the City of Houston is not going to be disconnecting anybody's water, whether it's individuals or businesses, through the end of April. Now, let me be very clear. We're not forgiving your water bill, okay? We're just not going to disconnect your water. Because if we are telling you to wash your hands, okay, whether you're living in someone's home or whether you're a business, we want you to have the ability to wash your hands. So through the end of April, we are not going to disconnect people's water bills. You will still owe it, but we're not going to disconnect. It's just the situation is too important that we think we need to put that in place. And then, as was done through previous storms when the community just stepped up or the organization stepped up to help, just today was having lunch at the restaurant in Asia Town with the Asia Chamber of Commerce, and they announced just today that they will be donating 20,000 masks to us, Judge, to assist with our first responders and others, Dr. Purse, Dr. Shaw. So that's 20,000. And the point, just over the weekend, through our own inventory, we advanced 10,000 masks to the medical center. And then just today, the Asia Chamber of Commerce has stepped up, and they are donating 20,000 masks so that we can protect, again, our first responders and healthcare providers. Those are the sort of organizations and people that we have in this city. And quite frankly, that's the way we're going to get through this. The burden is not falling on any one person or entity, but all of us working together in a collective manner, being responsible, we will get through this. And then tomorrow, I know I'm going to be meeting with some of the leaders in the faith-based community as we move forward. Because when we're going to do all that we need to do, but prayer still works. And so, but together, I know Judge and Judge Dalgo and Judge K.P. George and others that we will we'll get on the other side of this thing if we work together. So thanks, Judge. Dr. Purse.
Thank you, Mayor, and thank you, Judge Dalgo and Judge George, as well as my colleagues, Dr. Johnson and Dr. Shaw. We have all been working together entirely too closely. We need to keep a little physical distance, but we're on the phone a lot. So a couple of things I wanted to bring up. One is, just before this press conference, the Houston Health Department issued another press release updating the case that we first reported to you yesterday. It's a young woman who's visiting here from New York City. Well, I believe that she is a contact of a New York City case, so we know how she became infected. But the news update, we've been telling you that these are evolving investigations, medical investigations, and so the update that everybody needs to know today is that we learned that that young woman was at the rodeo on Sunday. She was not symptomatic at the time. She was healthy without symptoms at the time, but she did visit at the rodeo, and like any rodeo goer, we're still working out details, but we can stand it to assume that she was throughout many places within the rodeo and not in just one location. We've been asked that question before, and that will probably be an impossible question to answer, to ask a young person exactly where did you go, how long were you there, who were you next to at the time. Those are not reasonable questions. So I think that's an update that everyone needs to know. But it really kind of goes to the point that we've been discussing earlier, is that this is an evolving situation with the virus, and this virus is going to act like viruses act. And we just need to be smarter than the virus. And so we've talked time and time again about how we need to cover our cough, wash your hands frequently, stay at home. But the other thing is that we are now entering that phase where we're going to start talking about things like the large gatherings, as the judge pointed out, and as the county has suggested, gatherings of over 250. And I just want to point out the 251st person is not the problem. They're no greater a risk than the 249th person, okay? And so in this room, as we were standing, I was counting heads, and a couple more people have come in, but I got to just over 50 heads, so there's probably 60 or 70 people in here. And so the second bullet that the county has put forward is all gatherings in which people will be in close contact. And that's really what we need to focus on, is not the number of people necessarily, but how close people will be and for how long they will be together. And if you are ill, if you have symptoms, please do not go to those gatherings. as has been mentioned, and I want to remind everyone, is that together, when the community does their part and when government does its part, we will be successful. The community cannot expect the government to solve this, and we cannot expect the community to do it on its own. It's a partnership. We've been through these types of things before. Every time there's a different nuance to it. This one has its own nuances. The viruses, we don't know everything about this virus yet, but we will. At some point, we're going to learn how it's impacting our community. And as both of our government leaders, actually all three, including Judge George, has said, that this is not the time to panic. This is the time to have a plan, make a kit, and stay informed. Thank you.
Judge George.
Good afternoon, everyone. I am KP George, Fort Bend County Judge. As you all remember, we had the first identified case in Fort Bend County. And since then, I just wanted to first of all thank our partners here, Judge Hidalgo and Mayor Turner and all the health authority in this area. We held a press conference, I believe last Thursday, and they all came to Fort Bend County. Just simply that make us feel better, because this region, and of course it is not even a Fort Bend County or regional issue, it is not even a national issue, it is a world issue at this point. And so we are working together, and thank you for accommodating me here today, Judge and Mayor, and your leadership. And most of the time we are in almost all the time in contact, and also I just wanted to recognize our Health and Human Services Director, Dr. Jacqueline Minter, is with me here. If you have any specific question about Fort Bend County, how we are handling the situation, and I just wanted to, a lot of things is being discussed here because of that same reason. I don't want to repeat a lot of them, but we are following the suit. This morning I signed a disaster declaration in Fort Bend County. Now we are following our partners, and also we just held an emergency commissioners court meeting at 11 o'clock this morning to assess the situation and also provide resources to Dr. Minter to tackle the situation in our county. And also, as soon as I get back, we will be releasing community recommendation, as you can see on the wall, and we are going to follow the suit and recommend the same recommendation, gathering over 250 people in one closed proximity, and also all those information we are going to be releasing, and we are going to follow, and we are going to work with our regional partners every step of the way. I just wanted to say this, everything, and I'm so blessed I live in a community, we always brag about we are the most diverse and most inclusive community, and the same situation in Fort Bend County. We have more than 125 languages are spoken. That means people, maybe half of our population is traveling worldwide, and they're coming back. Unfortunately, in our county, we don't have any signs of community spread as of now, and things are evolving, as you all know. And so we will be, informing the media, and also the same message I have from the leaders before me. We cannot live in fear. We have to be cautious, and we need to treat this as a severe flu season situation we are dealing with, and I hate to see that our citizens are living in fear. And my message is, we will go through this all together, and we will prevail. Maybe a couple of months from now, this is going to be an old story we will be talking about. So, and I just wanted to say thank you for this opportunity, and if you need anything, and we have actually call centers set up at this point for citizens and also physicians and also our community partners to reach out to Fort Bend County to learn anything they need to understand anything about. We are standing by to help you all, and also visit our Fort Bend County's Health and Human Services website for updates. And again, one last thing I wanted to echo on our leaders mentioned before is get the information from the reliable sources and follow those information, because there is so much stuff out there, and social media is free, so people go and post stuff which is not true all the time. So get the information from the reliable sources, and stay tuned. And this is evolving every second as we speak. And it's an honor to serve Fort Bend County. It's an honor to be part of this, living in this region, and be part of all this discussion. Looking forward to continue to work with our partners. Thank you very much, Judge.
We've got time for just a couple of questions.
Dr. Shah, what's the capacity in the hospitals? Judge Hidalgo mentioned about if we ever have a case of 30% people with the virus, 20% need hospital. What's the capacity right now in the region to accept people with COVID-19?
Yeah, that's a great question. So as we know that during the regular parts of the year, the hospitals operate generally above 95% capacity, and during the flu season, it hits right up against 100% capacity, and hospitals go on diversion. You've been reporting on that for quite a long time. We're working with the hospitals now. They're fully aware of the capacity and the need for surge, and so there are plans that are in place that should they get to that 100% or 101%, that there are plans in place. So it's a little bit difficult for me to give you any kind of a value to that, because it's being done not only by hospital, but by hospital system. But what I think the public needs to know is that the hospitals are developing surge capacity plans, and I will just share with you to give you a mental picture of some of them. They're talking about things like taking areas of the hospital that aren't generally used for housing patients and converting those into patient care areas. They're talking about taking buildings that the hospital system may own that hasn't usually been used for patient care and making those patient care areas. So they're getting very creative. They're getting very much outside the box, if you will, and they're preparing for things that none of us hope that we get to, but should we get there, there are plans in place, and it's not just an idea. So if you're going to take a building that's going to require beds, so where are you going to get the beds from? They're figuring out where they're going to get the beds from. How are you going to get the linens changed? How are you going to, get medications over there? We need to just get rid of the hazardous waste that you need to get rid of. So all of those things are being planned and coordinated now. The hospitals are being, I think, very responsible in doing that, and hopefully we won't need to pull the trigger on that. But if we do, the plans are there.
How many Can we talk about the testing capacity and the process? So I think when you hear from the national CDC folks and
Right.
NIC folks, they basically said, we're way behind the rest of the world in testing.
Yeah.
And you guys have talked for a couple of days about how you guys are developing testing capacity locally. Can you kind of walk us through step by step what you have done, what is the current situation, what your goal is in a couple
Sure.
of days to come? Because I think that's what most of the public are really wanting to know. They're like, if I call my doctor, the doctor's like, go away.
Yeah.
Don't come to mine.
Yeah,
Don't come
yeah,
to
we're,
mine.
and we're hearing that. So a couple of, let's talk about testing from the lab perspective first. So as we've said in previous conversation, the test itself is not a simple test. It's a complicated test that requires special machinery and specially trained technicians to be able to do it. What the test actually looks for is the RNA amino acid sequence, okay? So they're looking for, truly microscopic things that requires a very high-tech test to be done. It requires a machine, so at the City of Houston, we've ordered more machines to come in, so we're waiting for delivery on those. We've actually got more people that are trained and to be able to operate those when they come in. But in the community, there are research labs, some at hospitals and some in the medical schools, that have the capability of doing this. Now, they need the right reagents to be able to do it. They've now got those. We've been working with them to make sure that they get them. And they've got to go through processes to make sure that their labs can actually, do the test and not have mistakes. So that is what's ongoing now. And I'm very confident that we'll have that available to us in the very near future, within days. And then in addition, the commercial labs are also, Quest and LabCorp in particular, they're also getting their testing capability up. So I will tell you that from the city standpoint, we've not had yet the situation where we had a rollover test from one day to the other, except maybe 1 or 2 days, and then only a couple of samples had a rollover that we couldn't get done on the day that they were submitted. Now, my fear is, and what we need your help with, is that we don't unduly frighten the community so that a lot of people come asking for testing that don't need it. Remember, the test, you need to be symptomatic in order for the test to give an accurate result. So if people are simply scared but have no symptoms, one of two things could happen. We could either waste a test on a perfectly healthy person who has no reason other than their fear, or number two, we could test somebody who is actually too early in their illness, and you get a negative test, and 2 or 3 days later they're feeling worse, but they say, oh, but my test was negative on Monday, and here it is Wednesday, and now I got a temperature of 104 and a deep cough, but I'm okay because my test was negative on Monday, when no, it was just too early. So we really need folks to understand that the testing needs, they need to talk with their doctor, have that interview, go through the process so we can then get them tested properly so that we efficiently use the testing capacity that we have.
Dr. Shutt.
Can I?
One second. I think Dr.
just
Shah
wanted to-
wants to add
I
something,
just
and
wanted to
then
add,
we'll take a couple more questions.
So I know we're two questions behind here, but so as Dr. Peirce mentioned about the healthcare system, Dr. Peirce and I just met with partners at Harris County Medical Society as well. And so we are hearing from our physicians that are out in the community, the clinics that are out in the community, that they are having concerns as well about, how do they feel the number of people that are either calling their offices or information that they're either being requested of or that they're asking to be evaluated, and how those systems are running. So what Dr. Peirce and I both did is that we indicated that the first thing that our healthcare system, not just the hospital system, but our outpatient clinics, is that we have to provide that information to them. And so we do, Harris County Public Health, operate the Health Alert Network, the HAN messaging that goes out to a multiple county region, the entire county, actually 16 counties. The reason I bring this up is that what I would like for the message to be to our physicians and our outpatient clinics is please sign up for that HAN messaging. So as guidance evolves, not just nationally, but also locally, you can get the latest information so you can understand how this is all evolving. Now, that doesn't mean that it answers all those questions, but we're doing our best to really understand what those challenges are, and then doing our best to provide additional information to our partners in the outpatient healthcare system. And so I wanted to make sure to add that as well.
Yeah,
17 cases in the region right now, and there are a lot of questions, and this goes to everybody. There's a lot of questions from the public that is watching live right now, that is watching this news conference and trying to get specific answers to why we are not hearing more about the people that have been diagnosed in terms of where they have truly been. All we're hearing thus far is in mixed messaging. You're nodding your head. Mixed messaging, one way or the other. Person's been on a flight, one person's been at the rodeo, but there's so much information that people are trying to
Got you.
identify.
Yeah.
Where have they been?
So let me answer.
Why are we not hearing more
Let me
about
answer two things, and I wasn't nodding at your question because I think we disagree with some of the things you're saying. So, two things. First, there's some information that we can't release because it would be identifiable, and so when we released, for example, the first information about the first traveler from Egypt, people were trying to find her home, and they published online, they're trying to dig in her home address. So that doesn't help anyone. The second point I want to make, and that's part of the reason we're making these decisions, is it's not an easy feat to suss out exactly where these people have been. So, for example, I wanted to come to you guys, and I expected somebody to ask, with what tent the man who went to the barbecue cook-off was at. I wanted to have that for you guys today. Our folks have been asking him, and he's not cooperating. The woman, that we're asking where exactly she went in the rodeo, she doesn't remember. If we don't have enough testing capability, there may be folks they got in touch with that we can't test. So we don't know. One of the cases we had, for example, she has a history of strep throat. So we didn't know, is it strep throat or is it coronavirus? We got to wait for it to come back. The man we announced this morning who has been in several flights, we're still trying to get from the airline the confirmation of which flights so we can offer that to the community. And so that's why just trying to go with our limited healthcare capabilities and just the nature of this disease and pretend that we're going to be able to get at every single detail and suss that out from the folks and track every person. We're doing our absolute best, but that alone is not going to keep us from having a spike. And so that is why we have to go to a blunter tool in a way, which is these recommendations. And we don't want to be at a point where we're so behind the 8 ball that we're having to make requirements like other communities are doing, and we're having to constantly lower down the number. So that is all, and everything we have that we can share, we have been sharing and will continue to share as we go along. Yeah.
We gotta go. We gotta run. Thank you very much.
Guys, we can do a live news
We'll-
conference where all
we'll
the
do-
citizens
well-
watching, and you guys are
well-
asking like 3 questions.
Well-
The entire city and region has many questions.
We'll take this one question, and then we'll do pull-asides. Yeah?
Yeah, the condition of the patients, especially the first ones diagnosed, how are they doing now? People want to know how bad
Yeah.
is the
So let me just address at least the Harris County piece, and then certainly I'll let Dr. Minter and Dr. Peirce speak to their case, their individuals. So by and large, so we have obviously 6. So we have the individuals are either hospitalized and doing stable, so that's the word we use, stable. They're not deteriorating. That they're doing well, or they're at home recovering. So that's and I think that speaks to the bigger issue, which is we do know that the vast majority of people that get novel coronavirus actually have mild symptoms, or some have no symptoms. But I think it speaks to also the other piece, which is why the judge, the mayor, Judge George, and all of our regional partners are really united in this, that we are very concerned, we are concerned obviously about the individuals that have, that we've already diagnosed, but we are very concerned about those who are at more risk, and that's seniors. The older you get from 60, 65 up to 70, 75, 80 and above, as well as those with underlying health or medical conditions, we're absolutely concerned about those individuals. And we want to make sure that we do everything as a community to protect those individuals. So that's very important. And Dr. Peirce and Dr. Minter, if you can speak to your...
Sure. So the first case that was announced in Texas, of course, occurred in Fort Bend County. That case is still in the hospital. He's still stable. So he's not doing any better, but he's not doing any worse. The other 5 cases that we had, one was in the hospital, was released, and is at home and doing much better. The other 4 have had their symptoms completely resolved.
One last question, either city or county, is the MD's office, as far as you know, investigating any deaths possibly tied to COVID-19?
So as we have been working with our Institute of Forensic Sciences, Dr. Luis Sanchez's office, and as far as we know, we are not aware of any deaths that they are investigating related to COVID-19.
Yeah. Thank you guys so much.
We can take questions.
We'll take Paula's sides. Thank you guys so much. Appreciate it.
It's all for... Sorry. All right. All right, let's put this thing together.